Prostate cancer prediction rates from the CDC are both good and bad. The good news is prostate cancer death rates are predicted to drop by 26.4%. However, prostate cancer cases in the United States are expected to increase. The increase in new prostate cancer cases is partly due to an aging male population. The average age at diagnosis is 66, and improved earlier detection tests available than in the past. Early detection of prostate cancer has been a lifesaver for thousands of men. When any type of cancer can be found at its earliest stage, the chance of survival is increased. A common early method used for detecting prostate cancer is the PSA test. Prostate-specific antigen, PSA, is a blood test and prostate cancer screening tool. It measures the amount of prostate-specific antigen in your blood. Both cancerous and non-cancerous prostate tissue produces PSA. Therefore, the PSA blood test can detect elevated levels of PSA that may indicate the presence of prostate cancer. Men, with a high PSA score, will be referred for a prostate biopsy. However, in some cases, prostate biopsies can cause anxiety, pain, bleeding, and infection. In addition, fewer than half of prostate biopsies detect cancer, meaning men may needlessly endure this procedure. In the past several years, new tests may allow some men with an elevated PSA or a suspicious digital rectal exam to delay having a biopsy. Following is a listing of these tests offering physicians additional data helping them determine whether a prostate biopsy is necessary or not. The Prostate Health Index, PHI. This blood test combines free and total PSA and the -2 pro-PSA isoform, P2SA, a form of PSA associated with malignant prostate tumors. The PHI test is used to reduce the number of unnecessary biopsies in PSA-tested men. In 2017, a study found that PHI scores influence the treatment plans recommended in men with PSA levels between 4 nanograms per milliliter and 10 nanograms per milliliter in 73% of cases. A low score led physicians to recommend not doing a biopsy, while a higher score recommended physicians to perform a biopsy. Fork score. This test also measures total and free PSA, as well as intact PSA, a form of free PSA associated with prostate cancer, and a related protein called human kallikrein-2. It factors in other elements such as age and the digital rectal exam. A 2016 study found that using the Fork score influenced a physician's decision out of nearly 9 out of 10 men, reducing biopsies by 65%. Multiparametric MRI. The number of physicians using pre-biopsy MRIs is increasing. One reason is for some men, an MRI can find them not to be a candidate for a biopsy. In addition, the MRI can reveal whether a prostate tumor is present and if it requires immediate treatment. The multiparametric MRI allows physicians to view the prostate anatomy, cell structure, blood supply, and other data. They also detected 18% of potentially lethal tumors that traditional biopsies missed. Other assays. Recent detection tests on the rise include ME Prostate Score, ME-PS, ExoDx Prostate, IntelliScore, and SelectMS. Men, who are diagnosed with an elevated PSA, should discuss with their physician on their advice on these tests. Some of the tests still have limited data, making them complicated. Also, insurance may not cover the cost of some of the tests. The bottom line, men should discuss with their physicians, guiding them on making the right decision is the best approach. Every man is an individual, and what's right for one man may not be right for another.